Gutom ka na?
Anong oras na? Alas 5 na.
아니 무슨 금고 일수 같은데? 아니 이거 왜 저한테?
고민하지 않는데.
오늘을 위해서라도 제발 좀 밀어놓고 가세요, 회장님. 장은 제가 거하겠지.
그래서 이사장님한테 다뤄드리면 안 될 것 같아서. 지금 막 나는 눈도 상태가 저렇고 확인해 보시고 문제가 없는 거면.
아니 지아버지한테 그렇게 얘기했다고요? 예, 알겠습니다. 무슨 말씀인지 제가 알아보고 조정한테 돌려드리겠습니다. 그럼.
저기 우리 무감이 병가 처리됐다고 들었는데요. 평소에 어차피 어울리지도 않고 사고만 계속 피해만 끼치고 그냥 그만두게 해주셨으면.
아, 그게 이제 제 맘대로 할 수 있는 일이 아니라서요. 인사 문제는 저 위에서. 그런데 우리 한 형사 어머니께서는 뭐 지켜줄 수 없잖아요.
For some, hello. Now we'll continue. When someone refused to cooperate with other employee, and you have to make an incident report for us, we are rated, or it's a critical incident technique. Unwilling to attend further training, and sometimes when you get anger to overwork or with some subordinates. Now, effective behaviors include the positive behavior that contributes to the patient care services. Now, ineffective behavior, these are the negative behavior which interfere good nursing care or lead poor nursing care. So, in order for you to render a good service or effective service care to the patient, you have a positive behavior. You could, because this feeling is that it can be transferable to the patient. If you feel negative and you are not feeling good or you are not in the mood like that, it can transfer the patient. The patient feel it about it. So it's better to have a good positive behavior. And during at work, you have to bring only what you have in front of you. You have to focus that one. Do not bring the problem or anything that is bothering you at home or anyone. Just focus on your work. Now, critical criteria for using critical incident is that the actual behavior must be reported rather than general feature or characteristic. So once you done a very good behavior or not good behavior, it must be reported rather than for the features or characteristic. The behavior must be actually observed by the reporter. So, the supervisor, like that. All factors in incident must be given. The observer must take definite judgment for that. So we have to be very careful for our doing. Now, the method of this critical is that to involve, it includes collecting of all information related with the incident, which involve the collecting of the details in the incident from the participant. Now, you have to identify the issue. After gathering all the information, you need to identify which issue are faced by a person or particular incident. You have to determine the ways to resolve the issue. It includes finding out the possible solution and how to resolve the issue based on the various possible solutions. Now, the evaluation of the resolution, which determine if the solution was selected and resolve the root cause of the situation and will cause further problems. So, it must be, the problem should be resolved, that one, and there will be no further problems. I think this one, it's all for hospital setting. If you have any problem with with your colleague and also through the patient, they could do any like for example critical incident report or any complaints that they could make you it's the same. Incident, number one, the student performed to have two parts. The number of incident, effective or ineffective, can be summarized, the period of observation, and can be mentioned in the form, the signature of the evaluator also, and the signature of the person who is being observed, and evaluated documents that could be included. Also, this one for the critical incident, or like for you are just like waiting for one person in that area, like that, or if there's any case study for one patient, like that. You could read this one. It's a self-explanatory.
근데 걱정이 안 돼요. 그래서
Now, I'll just only point out all the disadvantage for this critical incident technique. This will rely on the events being remembered by the user and will always require accurate and truthful reporting for them. Since critical incident is often rely on memory, incident may be lack in accuracy and may even go for unreported. The method of built-in bias toward the incident can happen recently, since it is easier to recall if it's done just few days like that. But if it's done for a long time, it is very hard also. Now we are done with the incident technique, critical incident technique. We will go for the other thing now, which is the observation, recording, reporting in nursing aid. Now, the methods for observation when we are in the hospital setting, we have to very careful. We have to use our five senses. Our five senses is it is here, which we could to evaluate our patient. For example, the using of sight. In our sight, you have to check for the patient for if there is any presence of rash. You have to check for the skin color, if there is any bruising or there is a bluish discoloration or any cuts for the patient. And another thing is that you have to use your sense of smell. The sense of smell, you have to use odor of the breath, the urine, and the body. There must be an explanation for that one, because there is an underlying medical condition or anything that what is with the patient right now. Like for example, if there is any changes in breath, like ketone breath, it's maybe the patient had diabetic. If also the urine, you see the urine, it's there is a brown, deep brown, or there is a colored like that. Maybe the patient has UTI, or or cloudy urine, have a UTI, or like for example, the patient have this hematuria. Or body odor, why the patient has having a body odor. This is very important for us. Example also for using hearing. If there is any wheezing sound, there is a coughing for the patient. Now, we need to report everything what we have seen for the patient. Reports are made to be immediately. Once that is something abnormal, you have to report immediately, thoroughly, and accurately. Dapat accurate yung you report it. Thoroughly, it must be strong. Use noted pad and pencil to write down information for reporting. Why? Why you have notepad and pencil to write down? So that you will not forget it, the information, so that you will not forget all the details. And then report only facts, not opinions. Yes. Like for example, objective data, the thing that you observe using your senses, and subjective data, the things that told the nursing aide by the resident. So you have to report the objective and subjective data only, which is the truth, not on your own opinion. Don't ever report a thing that you may think, I feel like that. No, it's not a strong report, that one. It must be subjective. Like for example, you see the patient is sweating, you see the patient is pale, like that, and it is the patient having this the patient having already hypo, so he need to assess the patient. Or for example, the nurse uh, the the nurse told to the resident that the patient has this pain. So you have to do what is only what you see, and what is subjective, what is verbalized. In reporting, observing the patient environment and uh, is very important. And it's also very important for the safety hazard for the patient. Um, you have to look for if the environment is free from a hazard. When reporting, things to be considered, the care and treatment should be given for the patient. At the time of treatment, the patient respond to care. And when you report, you also consider the observations helpful for the healthcare workers. There must be a complete information, complete data, how it happened, what time, and then what did she do, like that. So information resident has given that would affect on his treatment. Like for example, the patient have fall. Why the patient have fall, like that? So there must be an investigation. There must be a right why the patient turned out of like that. So dapat it must be strong, supported by evidence. Now, communicating with the other staff members, form of communicating. This is very important for observing and reporting also. Um, you could check by the body language of the body language of a person reporting or communicating orally or written communication. Like for example, sorry, there are so many body language that the patient you could see, or to your colleague. If it is good or bad, if it's offended, like that, it depends about how they react, the gesture, or even though they are not talking or they are not but how they move, how they react by their body language, it may be offended, like that. So that is the and another thing is reporting, communicating by communicating orally. When someone speak verbally, you have to report, or it is written communication. Like for example, a written communication is that the patient the patient or the doctor do an order. That is communicating with the staff members, because the doctor have an order, and then you nurse, as a nurse, you have to um, carry out that order. And also there are some things to be done that nurse should delegate to the nursing aide, like that. It's just like, so it is very important to communicate with the other staff member. A written communication, it is resident care plan should prepared by a nurse. One of each resident keep at nurse's station. You working for the record to provide consistent and well-planned care on a daily basis. Change and update made by licensed nurse, and information include. The nursing aid contribute by helping to identify the problem. So if the nurses if the nurses is updating the need uh, and the other information, the nursing aids also include by contributing by helping to identify the problem, because it's not always the time that the nurse is on the bedside, but you also, we are working as a team, so nursing aid is helping to identify the problem. You have to attend care for conferences, attending conferences. Nursing aid contribute by continuously directing question about the plan of supervisor, reporting to the patient, respond to treatment and activities. So this one, there are things that you need to report with the supervisor like that. So you help for the continuity of care of the patient. And also, we as a care nursing aid, after this lesson, and we have this patient, we have already a job. It's not only like that, we have to continue for increasing our learning. We need to attend some conferences to update us. Written communication, resident medical record, it includes by a record of a assessment, implementation, evaluation, management plan, progress note, and the permanent legal records. Usually this one is a written communication done by the doctor and also from the nurses, and also apart from nursing aid also. Because in hospital setting, there is a distribution of work. So each one of us has different assignments. So you have to report it and write a written assessment, implementation, and evaluation. Now, the purpose for this one recording is that it organizes all information on care in one document. Accountability, so care can be evaluated. Documentation, so there will be a knowledge, so each one of them has a discipline that we are doing. Confidential information available only to healthcare worker. It involves the care of resident or the patient. Confidential information available only to health workers involve also for the resident or the patient. Guidelines for charting if allowed by facility. This one, if they will allow you to do charting in the hospital, make sure when you do charting in the file of the patient, you have to enter the accurate and very easy to read information. You have to write what is accurate and very easy to read. Always use an ink, don't use pencil. You have to print unless scribe and accept form. And do not use the term resident. These short, concise phrases, you have to use very concise phrases for the patient. Always chart after you perform. So before you write in the chart of the patient that you have done this one, you have to do first. Hindi yung mga iba kasi ginagawa nila, nilagay na nila yung vital sign ng patient, they have taken already the vital sign of the patient, and there is already vital sign, there is already respiratory rate, there's already pulse rate, and temperature of the patient. Not doing it without but they didn't do it yet for the patient. It is wrong, and you are not working truthfully. So it's better after you do first the vital signs, and then after that you document. That is the right way. Always perform first to the patient, and then you have to chart it. Make sure your writing is legible and neat. Dapat it's clean and it's neat. Kasi this is legal things also. If something happened to the patient and they will not able to read your charting, and sometimes there is a discrepancy, you will be also what do you call this one, question about this one. So we have to write in charting, we have to make an entries which is accurate, easy to read. Always use an ink that is clear. You have to print it, and also do not use the resident term. Use a short concise phrases only. You have to do first before you chart, and make sure your writing is legible and neat. You use only abbreviation accepted by the facilities. Yeah, do not make an abbreviation which is the hospital is not accepted. Don't make an abbreviation that is only you who understand. This one be it's universal. Like for example, in medication, we write is AC or HS or BID, like that. That is acceptable in the facility. But if you use your own hindi nila maintindihan, they will not able to understand. And then make sure spelling, grammar, and punctuation are correct, because it is very important also. Sometimes we have to write nurse's note directly, diretso, without punctuation, without mark. It's just like like that. There must be punctuation, there must be like for example, correct grammar for that one. There must be a comma, there must be a period, because it is better for that one. Remember all the things that we are written in the chart of the patient, that is us. And if there is something happen, we are liable for this one, and we are all questioned for that one. And or interpretation. Write what is what you do and what is right. Do not write what you feel, what you saw, like that, but you see what is true, facts. Record in logical or chronological manner. Yes, you have to record by order, yung step by step. It's not by you finish, you started at the bottom and then you go up, or it's a mix like that. It's better you started receive the patient on bed, like that. Not given medication given, do ADL for the patient, and then you started you started from the beginning, receive the patient, like that. Before you start for the recording, you have to receive the patient, and then you have to do something like, for example, the ADL, and then you have to do by the way, what is ADL? Yan daw ang
Activity of
most
daily living.
Ayan daw ang most question sa mga most question for those who having this what do you call this one, nag-exercise sa mga OJT. So you have to know everything. They don't know it, how is it, like that. So first you have to receive the patient. When you see I receive the patient on bed, na ano ba siya, ano bang itsura niya when he is in good health with IBF fluid, like that, and what is what is contractures that we have for the patient. And after a while, what did you do if there's any complaint for the patient, like that. And after you do the complaint of the patient, you do the nursing action, and then what happened, the outcome, like that. It's not on from the bottom to top. It should be orderly and chronologically matter. Be descriptive, meaning to say that you have to describe it, because even though you tell like for example, the patient is high blood pressure. How come every word in nursing or nursing aid or a caregiver or in a healthcare, there is a reason why the patient become hypotensive, why the patient like that. There must be a reason why in everything. So you have to describe the patient. The patient fall because like this, side rails was not put, like that. So there must be a descriptions in all things. Make sure all forms added in a chart contain identifying information. So once you have to chart, you have to put your name there. You have to put your name, and it reflects all the things that you do. It come back to you. So it's not only that we are working, but we do it heartedly also for the patient. Okay. Now avoid using words that have more than meaning. Like repetition, or different words with different meaning, like that. Use patient exact word in quotation mark whenever it's possible. Always indicate the time of care for the patient, time of care when you receive, and then time you leave. Don't leave any blank lines. Sign in each entry on the first initial, last name, and the title. Correct error using facility procedure also. Now, there are some medical terms also that medicine has language of its own. The historical development composed of mainly the Greek and Latin parts consistently in uniform, especially for the medical, for the giving the medication of patient. There are three components: the prefix, root word, and suffix. Abbreviation. Help the healthcare workers to communicate quickly and effectively. Yeah, you have to use an abbreviation when it's necessary, and it must be very quick to understand. Shortened forms of word. You have to be concise in writing short form of words, like hindi yung like a storytelling like that. You have to be specific and short. Use a short forms of word. Reduce time needed in charting its important information. Conserve space and medical records. You have to conserve space also. Do not make a story. And use primary written communication. Now that's all for the for today. Observation, recording, reporting, and nursing aid. Now we will go to pain assessment. Is there any question? Short, sandali na lang, matatapos na. May tanong? Sus, Diggs, Tasi? Wala ma. Nagugutom na kayo. Esther?
Okay lang po, ma'am.
Kumain
Okay
lang
lang
kayo
po.
pag nagugutom na kayo. Kasi
Nag-i-snack po kami.
mag-snack na lang.
Okay
Okay.
po.
Wow, nice to see you, Tasi. Naka-uniform na.
Yes, hindi na po lockdown.
Okay. Now we'll go now to pain assessment. Now, definition, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage described in terms such as a damage. So, that is pain. There are symptoms, signs and symptoms of pain. There is increase of respiratory rate, meaning to say, tumaas yung RR mo, yung respiratory rate. It is more than 20. Di ba anong normal ng respiratory rate? Was 18 to 20. So, ayaw mo na. Yeah, like that. So become more, tumaas siya, more than that. There is also increase of heart rate. There is also a peripheral vasoconstriction. There is also a pallor for the patient and elevated blood pressure. There is also increase on blood glucose level. There is also diabetes. Those are the signs symptoms of pain. Now there are different pain classifications are classified. Pain is classified based on the duration. How long? How long the pain it may occur? Where is the location of the pain that you are experiencing? how is the intensity of the pain? Is it stabbing pain? Is it a dabbing pain like that? Or the pain or etiology? What is the source of that pain that you have? The types of pain. Pain, the based on duration. It must be, there are two. For the pain, the duration must be acute and chronic. Acute is a short term only. For chronic, this is a long term. It's long time already. For a chronic pain, these are the non-cancer pain. It is also a chronic cancer pain. And it's also chronic episode pain. Basta sinabing chronic, matagal na. It's a long period of time already. But it's acute is just recently. Now, acute pain, when pain lasted only through expected recovery period, it is described as an acute. Acute pain is protective. It has identifiable cause. You were able to identify if it is acute only. Maybe you are tired, like that. In a short duration of time. It has a limited tissue damage and emotional response. It is eventually resolved with or without treatment. You just only rest for a while. Like for example, you have chest pain. You have chest pain because you work too much and then you did not rest. So you just only sit for a while, for a few minutes, it will be okay. That is acute pain. After the injuries are healed, or complete pain relief also is not achievable by reducing pain or tolerable. Sometimes also there is a certain period of time if when it is acute, certain time to be finished. But for chronic pain is the pain that lasts longer than 3 to 6 months. And it is constantly and reoccurring with a mild to severe intensity. So, eto yung chronic pain, it will last longer, 3 to 6 months. And constant siya, it occurs with mild to severe intensity. It does not always have inflammable cause that lead to a great personal suffering. So, like for example, arthritic pain, nari may headache, peripheral neuropathy. That is some example. The possible unknown cause for chronic pain is combined with unrelenting nature or uncertainty of its duration, like frustrating patient, frequently leading to psychological depression or even suicide. Also, associated symptoms of pain include the fatigue, insomnia, anorexia, weight loss, hopelessness, and anger. Yung chronic pain, maybe it's a non-cancer pain. It's also like psychological, or chronic pain, maybe a cancer pain. It's really very painful. Or chronic pain, episode pain. It's episode only. May episode lang siya. Now, for the chronic cancer pain, the chronic pain that resulted due to the cancer disease condition termed to chronic non-cancer. Yung ano naman, chronic cancer pain is a cancer pain that caused by tumor, progression and related to pathological process, invasive procedure, may procedure siyang nag-undergone, toxicity of treatment, infection, and physical limitation. Approximately 70 to 90% of patients with advanced cancer experience already this one. Ito yung mga nasa stage 3, 4 like that they're having already experience for pain for the cancer. For chronic episode pain, ito yung mga pain that occurs sporadically over extended period of time or episodic pain only. For a certain time only siya, nagkakaroon siya ng pain. Pain episode lasts for an hours, days, or weeks. Pero it will not prolong longer time. Example, yung mga migraine, yung mga headaches like that. Now, classification based on the location. Ang pain based on the site which pain is located. It's also the headache, back pain, joint pain, stomach pain, cardiac pain. This referred pain is due to possible problems other than areas manifested in different part of the body. Now, yung intensity ng pain natin is based on when it is mild pain, moderate pain, or severe pain. Based on intensity, there must be a mild pain. The pain scale reading from 1 to 3. It is considered a mild pain. When it is moderate pain, the scale reading is from 4 to 6. Considered as moderate pain. But when the pain is severe, it is read as 7 to 10. 10 is considered as a severe pain. Now, ang classification naman, if it's in etiology, pain based on etiology, it is nociceptive pain. It's either a somatic or visceral pain, or neuropathic pain, which is peripheral neuropathic pain or central neuropathic pain. Ito siya, nociceptive pain is experienced when it interact properly with function nervous system, send signal to the tissue that is damaged, requiring attention and proper care. Ito kung talagang yung ano natin, nervous system, nag-send na siya ng signal immediately na may na-damage na yung na-damage yung tissue natin, we require attention and proper care immediately. For example, pain experienced followed by cut or broken bone alerts for a person to further damage until it's properly healed. It is stabilized or healed by pain goes away. Like for example, yung mga fracture, agad-agad dyan, it's immediate attention and proper care agad. Because if you will not take care, medical attention for this fracture, it may cause you for too much bleeding also and very painful, and the patient really cannot tolerate. You need to have this immediate action and proper care. Yung somatic pain naman is originated from the skin, muscles, bone, connective tissue with a sharp sensation, proper cut, aching from a sprain or ankle. Common example is somatic pain. Ayan yung mga example from the pain. Skin, muscle, bone, or connective tissue. It's really a sharp sensation. And the visceral pain naman, which is pain resulted from the activation or nociceptors of the thoracic, pelvic, and abdominal visceral organs, which is characterized by cramping, throbbing, pressing, or aching qualities. Like for example, if you have this labor pain or angina pectoris or irritable bowel movement, ayan yung mga visceral pain. It's a throbbing, pressing, and pain yun. Neuropathic pain is a neuropathic pain associated with damage or malfunctioning nerve due to illness, injury, or undetermined reason. Like for example, diabetic peripheral neuropathy, phantom pain, phantom limb pain, spinal cord injury pain, like that. So kasi marami siya mga nerves na connected for this one. It is usually chronic and it is described as a burning, electric shock, or tingling, dull, or aching. Neuropathic pain tends to be difficult to treat. Neuropathic pain has two types based on the parts of the damage. It's either peripheral neuropathic pain or central neuropathic pain. Now, yung peripheral neuropathic pain due to the damage of peripheral nervous system, like yung phantom pain limb. Yung central neuropathic pain naman result from malfunctioning nerve in the central nervous system. Katulad yung spinal cord injury natin, that is also very painful.